Hello guys, today I'm going to talk about a PowerPoint which has been sent to be my student asking about doubts on the OSCEs which has been kept at their institute. So I'll try to solve them one by one in most effective way as possible. So some many of times in your OSCE examination they can give the pictures of this famous personalities who has contributed good enough in the cardiology, and that's why you all need to remember those names because that becomes important. So he is Heinz Wellens. So as we all know, we talk about Wellens syndrome. So he was the one who described the Wellens syndrome in that. So Hein Wellens is one of the famous cardiologists which you should be aware of. Next is Willis Hurst. As we all read the book of Hurst's this book of cardiology, he has contributed very well in it. So you should remember his face as well. He is Willis Hurst. He is the Braunwald, so called the godfather of cardiology. So Eugene Braunwald, he is the personality of the book which we read, the Braunwald test book. And she is Dr. S.I. Padmavati, who is the first Indian female cardiologist. She is from Myanmar. So she is recognized for her lot of contributions in cardiology, and she is the S.I. Padmavati, first female cardiologist. So this is a spotter which can be asked many of times. You can see this ECG is a 12 lead standard ECG. As you can see that the bar consists of 10 small squares. So this looks like ST elevations MI in the anterior leads, that is V2, V3, V4, V5, V6. Many of time this is classically seen in patients of Takotsubo cardiomyopathy. So the only way to differentiate them with STEMI is by doing a coronary angiogram. So just a minute, I'll just have to click this. Okay, so here you can see a LV angiogram. This is ace of spade pattern. So you can see here there is apical ballooning. You can see here this part is there is apical ballooning. Keep seeing that apical ballooning. You can see spade of ace pattern. So spade of ace is nothing but so the card which is there. So which we play in that playing cards, the spade of ace pattern, which is characteristic of Takotsubo cardiomyopathy. It is also one of the causes of MINOCA, that is myocardial ischemia with non-obstructive coronary arteries. Okay, so it's a classical picture of Takotsubo cardiomyopathy, that is stress cardiomyopathy. So this is nothing but is called as the penumbra, which is frequently used in mechanical thrombectomy. So this is called as penumbra catheter device, which is used for mechanical thrombectomy in patients of stroke or acute ischemic stroke. Also can be used in deep vein thrombosis and pulmonary embolisms as well. Suppose a massive embolism is there, you can use this device for that. So this is the penumbra reperfusion catheter for mechanical thrombectomy. So this was another ECG which was given. So you can see here, this is again a standard toilet standard ECG. You can see there is two patterns of QRS. One is the negative axis and one is a positive axis here. So the axis is changing every alternate beat, and this is a broad complex. You cannot see a P much wave. This is nothing but a bidirectional VT. So bidirectional ventricular tachycardia, it is seen in digoxin toxicity, classically seen in digoxin toxicity. So how do you manage this patient is basically you have to abort this VT by giving either you give lidocaine or phenytoin. Amiodarone is not much useful in digoxin toxicity. You can give either phenytoin or lidocaine, and you have to also give digibind to remove the toxic decoxin. So digoxin is given. So this is classical bidirectional VT.